everyone, and welcome to the second episode of MedTalk, a medical skill building career conversation between doctors, for the doctors, and by the doctors. And who do we have here with us today? A living legend. Everybody knows him, but I yet have to introduce him. Dr. Advani, Senior Medical Oncologist, Mumbai. I don't think we can say Mumbai anymore because I think he caters to the whole of India and abroad. I don't think anybody who once has a diagnosis of cancer does not think of Dr. Advani. Thank you, sir, for gracing the occasion. And we have a very young, dynamic doctor who's just entered into our field of medicine after winning a MD medicine degree and a MedEngage award, Dr. Sushruth Ingavale, who is the assistant professor at KEM Hospital. He did his graduation and post-graduation both from KEM Hospital and Apex Institute in Mumbai. Welcome, Dr. Sushruth.
Thank you.
Sir, I have seen interviews of yours, and we all know the mega giant medical oncologist. But I think I want our doctor audience to get an insight into the person behind Dr. Advani as a child, as an adult, and today as a senior person. And what are the three main decisions that you took in all the three stages of your life that actually made you reach where you are today?
Yeah, I think the most important part of my decision was made at the age of 8. When I had polio, I was admitted in the hospital for almost 3 months. And every day morning, the doctors will come on the round and they will smile with you, they talk to you. So that morning was the best time for all the patients, including me. And they used to come, all the doctors used to come with a white coat. So that white coat attracted me. And since then, my decision was, if anybody used to ask me, what you will become, I'll say doctor. So that was the thing. And of course, then the studies went by and I was probably good in the studies and scored nicely. And I was eligible for the admission in the medical based on the marks. But then because of the physical handicap, they said that they cannot take me. So that was okay. I mean, it was hurting, but at that young age, you have decided, you have achieved, and then suddenly somebody puts a brake. So it was difficult. But I continued the another course in mathematics, but at the same time, I did not forget this. And therefore, those days, we did not have many means. And so I took up an inland letter and wrote a small note to the various authorities. I wrote to President, Prime Minister. I just posted it. I didn't know whether it would reach them or not. Health Minister. And ultimately one day, the Health Minister of Maharashtra, he rang me up from his cabinet secretary, rang me up that we have decided that you should get admission. Go and meet the Dean of JJ Hospital.
Wow.
So that was a big thing. So I went and he was very nice. I remember his name, Dr. Virkar. He says, very good. In the interview committee, he was also. So it was very difficult for him to say no. But he said, because everybody else said no. He says, I'm willing to take you up. We'll give you the seat, but don't ask me any concession. He told me. I said, no, I'll not ask concession. So then I started, and I could really do everything sitting on the wheelchair. It was not difficult. Everything, right from anatomy, physiology, to medicine, everything I could do it. And of course, I had a lot of friends and colleagues. Everybody was so nice. Nobody distinguished me. So I think that was a very good thing till I achieved MBBS. And then again, the second sort of difficulty came up. Everybody was advising that to go for a branch where you have to just sit in the one small lab and do your work. So I say, no, I want to move around, meet people, interact with them. And that is what is my life is. And so ultimately I got the admission into medicine. And since then there's no, then whatever I've chosen after that, it has come. So I chose the oncology. I went and joined the Tata Hospital and I worked over there and everything came up.
Wow. I think everybody is a bit moist-eyed with goosebumps listening to this. Hope in the moment of adversity. Where there's a will, there is a way. I think everything has got as exemplified by Sir. I can just imagine a cute little Sir sitting in a hospital bed, taking a decision right there and then that this is what I want to be. And that is for all you young doctors. If you have decided to do something, don't give up. Don't look at surroundings. Reach out. Somebody somewhere will help you. I mean, I don't think when he wrote those letters, he thought that the health minister will respond, right? But he did. There's always a good Samaritan somewhere. Otherwise, the world would come to an end, right? So amazing, sir. Kudos to you for that. Oh, Dr. Shushruth, are you going to be able to speak after this? So, first of all, congratulations to you on just achieving your MD medicine degree and being a MedEngage winner. So, first of all, would you like to tell the young audience that what are the 3 medical trends today that are necessary for every doctor to know, even if they have to survive, right?
So first of all, thank you for having me here. I'm very blessed to the interview with Dr. Advani. And coming back to the question, so the 3 medical trends that everyone needs to be aware of, I think first part would be changing role of a physician or the responsibilities of a physician, wherein traditionally what has been is you treat a patient, you are a clinician, that makes you a good doctor. While the expectations and the surroundings are changing for us, and a doctor, the central dogma of being just a traditional doctor is changing into an evolving concept of wherein you are a clinician, where you are a researcher, where you are a teacher, on top of being a good human being of character. So on that note, I always say a medical doctor or a clinician will on an individual basis treat one patient, while a medical teacher through his students will treat hundreds of patients, while a medical researcher by ground impacting research will treat millions of patients. So I think it is now necessary to acquire skills in all 3 and go ahead with it. And just that is my first takeaway about it.
Wow, Dr. Shushruth, I must say, he just said what embodies each and every doctor, right? Today, as doctors, we try to be good human beings. We are obviously good in our subject, should be, and we have to teach and we have to keep an eye on the research side. Otherwise, we will not be impacting enough, either in terms of quality or in terms of quantum. So thank you for that embodiment, Dr. Shushruth. Yeah. So what are the trends? Can you now move on to that?
So moving on to the second trend that I think is bridging gap between technology. And like one fine day when I was in MBBS, when I was third year student, I was working one of my friends in IIT Bombay. He was an engineer and I was helping him out with a digital stethoscope. And when I had conversations with him, he said, for us engineers, the healthcare is the only field which is untapped. Like automation, artificial intelligence has percolated in every other sector, but healthcare is something there which is still a blue sea and is yet untapped. So I think there's a lot of coming in, especially gene therapy, nanotechnology, and artificial intelligence. They are going to revolutionize this field over the next couple of decades. Just for example, take POCUS, like point of care ultrasound, is something which is coming to bedside medicine and is becoming very important for any practicing physician to acquire. And apart from that, the third thing that I see a trend is rise of medical entrepreneurship. So it is not only in terms of clinical practice, but there are a lot of entrepreneurs who are getting themselves in training or having and imbibing a new skill set, or even medical education for MBBS students. So these are the three trends that one should be aware of to be successful.
Yes, absolutely. So, to summarize, be a good doctor, be aware of what's happening next. And engineering and medicine are bound to, now marry each other. But as I would say, the guardians of medicine are trying to just make sure that it does not impact adversely. So I think that is the only, hitch. And as we find ways to overcome that and be sure that technology is helping and not, impacting negatively, I think we will see an excellent marriage between engineers and doctors. So, yeah. So, medical knowledge and skill is an absolute must know. I mean, no doctor should be even allowed to practice if that's missing. But in spite of all of that, sometimes, you need something beyond the medical skills also, non-medical skills, which are equally, if not sometimes more important, I would say, than the medical skills to actually, help at the last mile or help the last patient. What do you think, according to you, are three absolutely mandatory non-medical skills that every doctor must build?
Yeah, I think this is very important because you're not treating an individual or machine or anything. You're treating a human being. Human being, apart from the disease, it has so many dimensions. So you have to treat overall. And that's where the skill of the physician or surgeon or doctor has to be. The most important thing is that you have to satisfy yourself as a doctor that you are diagnosed properly, you are treating properly. That's a basic thing. But apart from that, what happens to the patient? Is patient satisfied? Is patient happy with that sort of a thing? Which is, I think, is important. So I always believe that when the patient comes in your office or wherever, he comes with a very serious face, he's worried, but he must leave the office smiling. That is where your judgment will be there that yes, doctor is successful. So what it means is that you have to really make the patient understand about his disease, everything about the disease, and also informing him that how we are going to help him. We may be able to cure him, we may not be able to cure him. That's a different thing. But that how we are going to help him to overcome his disease. And I think that's where it's. So the most important thing in this place is that one is the smile. I strongly believe in smile. In my new hospital, my vision is to have a smiling atmosphere in the hospital. Everybody who joins have to learn how to smile and then join. So I think smile is the most important thing. And I have seen many doctors, they keep very serious face. When the patient comes in, they look at him very seriously. And then they read the reports and all, they become more serious reading the reports. And then when they are expressing, they become more serious. So I think that's the worst thing to happen to the patient. I personally feel we must greet the patient with a smile. Say a good words, kind words, which we do to everybody else. Why not patient? How are you? How are you coming over here? From where you have come? And relatives are there. Make them seated. Please sit down. Let us discuss your case. And then start questioning. And then look at the reports. The trouble is nowadays, young doctors have no time. They have no time. The only thing they do is, as soon as the patient comes, open up the whatever case papers are, read everything. They don't even ask the patient, what is your problem? They are reading reports and all. Then they tell him that, yes, look, you have this disease. That's okay. They have done their job nicely, but they have not done their job at the level of the human being. They have to talk to the patient, explain to him everything, what is the disease. And I think, so this total approach is the most important thing. And that's where I feel that the people who are the most of the doctors who reach to the top, they have all these abilities, which you don't imbibe very soon, but takes your time. But I think slowly you learn how to imbibe these things and also have a good mannerism. I think that's important. We all do in our meetings and all, but with the patient also. And I think that's where some of the places in, where the doctor not only welcomes the patient, but also when the patient is going out, he joins him and leaves him till the door. And I think that's a wonderful feeling that the patient gets.
Total approach, doctors. It has to be a total approach. Sir made a very, very significant point. And since, he's an oncologist, I would like to quote from the book by Siddharth Mukherjee. It's a biography of cancer, Pulitzer-winning prize. And he says that the patient is willing to go on fighting, provided he knows what is it that he's fighting for. So you can't just tell the patient that, look, this is your fight, why, how, and help him. And the second point that Sir made, sir, I have a personal experience with this. I do not want to go into the details, but my very close family got cancer. And we being in Bombay, my husband and I, both doctors, we, chose the best 3-4 hospitals and we took him everywhere. He refused to get treated, at most of the places. And finally, the doctor and the hospital that he chose, sir, did exactly what you said. He greeted him. He spoke to him courteously with good manners, gave him the respect of being an elder person, explained his disease to him, told him he's got this, he'll manage it. He showed him statistics of how he's managed patients like him and how they are doing. He gave him an idea of when and how will he recover over the next, 6 to 9 months. And then he left him to the door. And when he left him to the door, that was the winning moment. And he was like, we'll go with this doctor and this hospital. Nothing else made a difference. It was just the way, the personal interaction and the mannerisms. So thank you so much for bringing that out, sir. And I hope all the doctors have registered this. Many of us are already practicing it, but some of us sometimes, in our busy lives and in our crazy schedules, we may miss. All of us do that. So I think let's promise ourselves today that we're going to, work on what sir just told us and build it as an integral part of our personality as a doctor. Thank you so much, sir. Dr. Shushruth, MD medicine is a very difficult, nuanced specialty, of this subject. How did you decide and why did you decide to do MD medicine? And now that you have decided it, what are your goals and which are the learning platforms or tools, technologies that you will use during your journey to, achieve a larger than life goal like sir?
So thank you for this question. I would like to answer this question in 2 parts. First of all, deciding the career pathway after MBBS, and second is about the specific tools. So coming to the first part about why medicine, let me talk that the traditional pathway of having just being a doctor and treating the patient, now you are exposed to n number of spectrum of what you can be after MBBS. So there's a video on my YouTube channel, Dr. Sushruth Ingavle. There's a 30 to 40 minutes video wherein you can look at various pathways that you can have after MBBS. There are pathways where you can go directly hardcore medicine, you can go juxta medicine, as in you have the medical field knowledge and you imbibe administration, go into healthcare administration, you imbibe technology, become a medical technologist, etc. And there are some pathways which are outside of medicine, where you purely kind of go outside of medicine. So you can check that as well. But coming to my own story about why and how it happened, I don't think it was a decision that I took overnight. It was a gradual process. I remember as a student being posted in medicine wards in the second year of MBBS, and I enjoyed it. In my third minor MBBS, my medicine department nominated me to attend a fundamentals of oncology program, which was in collaboration with King's College London and Tata Memorial Hospital. And that was the first time I got introduced to so-called physician scientists, and I had an interaction with them. And this is somewhat made me feel, yes, I need to be like them. Then I moved to final year. I studied medicine. I liked it. Then I moved to internship. In internship, it was a mixed experience that I saw patients being brought in the brink of the death, and then they getting better and going home. So I do realize that it is a very challenging job, but I was okay with it and I wanted to take it. That is why I decided to go for MD medicine. I did my residency. Third year was very very difficult because of the COVID pandemic, and it's a opportunity, I would say, rather me to be able to serve in the pandemic. It is a once in a century opportunity. And I have recently completed my medicine, and eventually now I am looking forward to follow the path like Sir did. After Sir did his MD, he went on to US and did a fellowship. So that is somewhere I am also inclined to. I'm planning to get a fellowship abroad and maybe come back with something new. That is the thing I'm planning to do right now.
Best wishes to you for this
Thank
huge
you.
task.
Thank you so much. And coming to the second part about the specific tools that can help me in this or have helped me in the prior journey. One is, I think, PubMed and UpToDate. People should have fair and decent knowledge about using PubMed and UpToDate, not only in just during exams, but as well as during day-to-day clinical practice. Because the knowledge in clinical medicine is increasing exponentially, and it is not possible to keep everything in mind. So it is our duty to get the best care for the patient, and you have to take the support of the technology. So that is one. Second is communication skills, as Sir has focused already. So communication skills, may it be verbal communication or non-verbal communication, may it be in formal scenarios where you're making or presenting a PPT, or it may be informal with friends, or it may be with the patient. So on that aspect, my mentor, Dr. Salagre sir, has taught me a lot, and I'm still a learner about how to progress on the communication skills. And that is something I think every student must be aware of. The doctor-patient relationship, I think the most important factor that needs to be improved is communication skills. That will solve a lot of problems. And third factor, I think I am a little bit aware about Google Sheets. I do a lot of research, that is why I use Google Sheets. But I have over time used it not only in research, but also to organize my task, to-do list and all. So that helps you be a little bit more organized. So the three tools I would recommend is UpToDate and PubMed. Second is communication skills. And third is having a decent knowledge about Google Sheets.
Okay, doctors, you know now what you need to refer to and see to, be able to win this war, right? We cannot close the session without Advani sir giving us some advice on oncology to our young doctors. Sir, to a budding doctor who wants to become an oncologist, what is the advice that you would give to them?
Yeah, I think the most important thing for everybody, not only young, but even old, is to keep on learning. I think there's no place that you will, once you stop learning, you have stopped your profession. So that's the most important thing. Keep up with the newer knowledge, newer information, basic science, understanding of it. It's not just superficial. Go into the basic of that and try to understand how this has developed over a period of time. I think that is the most important thing. And nobody can have the excuse of not knowing that. If somebody says, oh, I'm very busy, I can't know all these things, that's not an excuse. You have to know if you want to excel in your profession, whatever profession you are doing. Otherwise, it will go stale. And important thing to remember is that the patients and the whole community is looking at you. You are not the, sort of a miracle man. They are looking at you. They are studying you. And that's what I feel. That when the patient comes to our room, the patient is looking at us. He knows what are we thinking. He knows everything. If you are in a hurry, patient knows from your body language. The doctor is in a hurry. He is in no mood to listen to me. So you have to really make sure that whatever you are doing, even talking to the patient, you give him everything. You have to give him from your body language also such a feeling that I have every time for you and I am only for you. I think that gives them the more. And that's where I think all of us have to learn how to use our body language also whenever you are dealing with the public or dealing with the patients. I think that. So I think knowledge and information, experiencing it, and the acquiring new insight, the new technology has to be a part of our learning throughout till we are practicing. Once you stop practicing, then you can relax.
Sir, on behalf of the entire team and the audience, I would like to say a very special thank you to you for taking on the time from your busy schedule and giving these pearls of wisdom to the industry and the community and the medical doctors at large. Thank you so much, sir.
Thank you very much. We have enjoyed conversation.
And thank you, Dr. Shushruth, and all the best to you for your amazing journey ahead. All the best.
Thank you, ma'am. Thank you, sir.